Did you know that people without an advance directive often die a painful and uncomfortable death? For example, their ribs are broken and even their lungs can be punctured during the CPR process. I wish to impress upon you the importance of choosing an advance directive in palliative care for your own end-of-life days and the benefits that it will bring to you and your family, such as spiritual, emotional, and financial needs. And more of this will be explained as we go along. As being a healthcare provider for over 15 years, I have had the experience of taking care of patients with and without an advance directive, and the outcome of both are very different. By choosing an advance directive in palliative care, the benefits to your family are many. For example, you may even encourage someone else in your family to follow your lead and manage their own end-of-life care. The benefits to hospice is that your pain is managed, which is the most difficult aspect of dying, and your family will be able to be with you without machines attached to you during your last moments. They will remember you dying in peace and without pain. I want to discuss 4 reasons for choosing advance directive palliative care and hospice care. First is the need for education. This education begins by having a conversation at home with your family so that they know your desires. This conversation will comfort your family because they will know what to expect during your time of transition. Your family will have the satisfaction in your choice in palliative care versus traditional medicine because it will allow you to die with dignity and in comfort, and allow your family to spend more time with you without the worry of financial cost. Your family will be with you up until the very end, even as your body begins to expire. The staff at the hospice will support your pain while supporting your family's emotional and spiritual needs. All of us have lost a loved one, yet most of us have not thought about our own end of life. Job 14:1 says, "A man born of a woman is a few days, and it is full of trouble." Would you want to have your last days full of peace before leaving this world? Choose for yourself to die with dignity and help your family to have the support they need during their time of bereavement by signing an advance directive and choosing palliative care. No matter what your age is, the natural action of death will happen to all of us. And choosing an advance directive and end-of-life care will make this transition of your life easier for your family and even more memorable. Sometimes people even take pictures. Visitors can come and begin the celebration of your life. Families will require emotional and spiritual support throughout the transition process as well as the final goodbye. The staff at hospice will give them that support with the understanding that pain is not only to the patient but also to the family members. The National Hospice and Palliative Care Association defines pain as a sensory that is unpleasant and is an unpleasant experience associated with potential tissue damage. Pain normally protects us from danger, but in this case, pain is a real cost. The staff at hospice will manage your pain with medications such as morphine and manage your family's pain with pastoral care. Your family will have the satisfaction in knowing the financial benefits to them once choosing a palliative care program, which in most cases are covered by Medicare and Medicaid completely. However, sometimes private insurance will ask that a copay or other out-of-pocket costs be covered, but this is of no comparison to the greater cost of the end-of-life care. The Wall Street Journal states that 6.6% of people who entered the hospital system under the Medicare or Medicaid hospitalization care have died, and that 1.6 million of these people account for 22.3% of the total hospital cost expenditure. Without the burden of financial costs, your family will have time to spend with you that will bring back memories and warm thoughts as you are surrounded by your loved ones. Because your family will have the opportunity to have been educated on the physical transition process, it will be easier on them. For example, the transitional process in traditional medicine is that you will be sedated, possibly on a ventilator, unable to talk, express your pain levels, or even say your final thoughts. And unfortunately, for many people, dying without dignity and in pain is a real deal. They experience unnecessary testing, unnecessary procedures, and strangers such as myself around them. However, in hospice care, your body will naturally go through the process of the physical changes in order to transition to death. Your family will see coolness, sleepiness, disorientation, incontinence, congestion, sometimes known as the death rattle, a decrease in intake, a decrease in urine output, a decrease in socialization, and lastly, withdrawal, restlessness, and finally, saying goodbye. As a healthcare professional, there is nothing more heartbreaking than taking care of a patient who has been sedated, on a ventilator, and have no choice in their own dying process. So again, please make the choice about your last days on earth. Visit your local hospice center and pick up educational materials such as this from the St. Elizabeth Hospice Center before you make your final choice. Dying does not have to be a burden to you, your family, or to the taxpayers. And by choosing a hospice care, your family can be relieved of the burden of making your final arrangements, or even remember you connected to tubes and machines, and taxpayers do not have to be burdened with the cost of your care. And you do not have to experience pain and misery and unnecessary testing and procedures. As a healthcare worker, I recommend that everyone have an advance directive and end-of-life care planned out for their last days. In conclusion, if you are ever faced with end-of-life or terminal illness, I encourage you to die at home, surrounded by loved ones who are able to laugh and reminisce and remember the good times of what being a family is all about. Thank you.